Are you tired of being told that your lab tests are normal and you still feel awful? What if the answers to your chronic bloating, fatigue, and gut pain are hidden in plain sight? In today's episode of Gut Fix, I want to pull back the curtain on functional lab testing to show you what's really going on inside your gut. Stay tuned. Hey friend, welcome to Gut Fix. Are you ready to finally get rid of those debilitating digestive symptoms? Do you catch yourself staying up late Googling things like, what can I eat? Or how do I stop a flare? Or maybe you're just lying awake wondering, how did this ever happen to me? I'm Wendy, and I've been exactly where you are, desperately searching for answers, but determined to find natural solutions. And like you, I was overwhelmed by all the conflicting information out there and unsure of what might really work for me. And so now in this podcast, I'm here to share with you what I've learned, how to listen to your body's signals, and uncover the common mistakes that might be standing in the way of your healing. So grab your favorite drink, pop in your earbuds, and let's dive into your health transformation together. Hey there, and welcome back to Gut Fix. I'm Wendy Handy, functional diagnostic nutrition practitioner and fellow gut health warrior. So today I want to dive into a topic that is at the very heart of what I do, and it's often the biggest turning point for my clients, and that's functional lab testing. So if you've ever been to the doctor with symptoms like bloating, fatigue, or abdominal pain, only to have your blood work come back, quote unquote, normal, and be told everything is fine, then this episode's for you. It's for every woman who's ever felt dismissed, frustrated, and left without answers, knowing deep down that something's wrong. And that was me too. So you're not alone. And you're also not imagining it. The problem is definitely not you. It's that these conventional tests are often looking for the right things. And so today I want to kind of demystify the world of functional testing and show you how these advanced labs can finally give you the clarity and direction that you need to actually heal. So think of it this way. Conventional lab tests are designed to diagnose disease, and they're looking for clear-cut markers that fall into a disease or not disease category. And they are incredibly important for identifying acute issues, but a lot of times they're going to miss those subtle underlying dysfunctions that lead to chronic symptoms. They're not looking for really why something is happening or what's causing something to happen. They're looking to get rid of the symptom is really what it comes down to. And functional testing, on the other hand, is designed to assess function, right? Just like it says. And it helps us to understand how well your body's systems are working or maybe not working, right? We're not just looking for disease. As a matter of fact, what I do, I don't treat or diagnose anything. What we're looking for is those imbalances, deficiencies, and those hidden stressors that are preventing you from feeling your best. And the reference ranges between conventional labs and functional labs is often very different. So conventional labs use what I'll call, for lack of a better term, a bell curve range. And it's based on general population. It's based on a very wide range, all age ranges, and all levels of health too. Healthy, not healthy, the whole 9 yards. And let's be honest, it isn't always the healthiest group, right? So functional ranges are much tighter. Their ranges are not quite as wide. They're definitely not as wide. And based on what we know is optimal for health and vitality. And so this allows us to sort of catch those problems long before they become full-blown diseases or big problems, right? It's about being proactive and not reactive. So while there's so many tests available, there's three main ones that I find give us the most comprehensive picture of your gut health. And the first one is obviously the GI map or the comprehensive stool test. I know, nobody likes to talk about their poop. But your stool provides an incredible window into your digestive health. So it isn't just your standard hospital stool test, right? Looking for like a parasite or something. It's a very deep dive that can show us things like your gut microbiome. We see if the balance of your beneficial bacteria or there's any overgrowth of what we call opportunistic or bad bacteria, and whether you have yeast or candida overgrowth, things like that. It also looks at your digestive function. So it measures markers for how well you're digesting your fats, your proteins, your carbs. It can tell us if you're even if you're producing enough digestive enzymes. And then, of course, it looks at inflammation and gut immunity. So we can measure very specific markers for inflammation, like calprotectin. And if you've been to a GI doctor for your IBD, you've probably heard a lot about calprotectin because that's the one that they hone in on. And it's especially relevant, for the IBD group. And secretory IgA, that also tells us about the health of your gut's immune system. And then, of course, we've got some leaky gut markers. We can even see those markers that might suggest increased intestinal permeability, right? So this single one test is going to give us a roadmap to understanding a lot of why you're experiencing the symptoms that you're experiencing. Another good one is for the gut specifically is the SIBO Breath Test. And that is, it stands for small intestinal bacterial overgrowth. And it's a condition where bacteria that should be in your large intestine has migrated into your small intestine where they don't really belong. No, not really. They definitely don't belong. And when you eat, these bacteria ferment the food. And that produces a large amount of hydrogen or methane gas. And the result is intense bloating. A lot of times it makes you even look like you might be pregnant. Gas, pain, sometimes constipation or diarrhea. And SIBO is a major cause of IBS. And it can be a huge factor too in IBD. And so that's a very simple at-home breath test that is really the gold standard for diagnosing SIBO. And then specifically for the gut is the food sensitivity test. And you've heard me talk about this one before. We've actually had the CEO of one of the major companies, KBMO, the Fit 176 food sensitivity test. And these can measure your body's IgG immune response to a very wide variety of foods. And unlike a true allergy, which is an IgE response, these sensitivities can be delayed by hours, even a couple of days. And that makes it really very incredibly difficult to pinpoint, these issues on your own. And these reactions, what they do is they create a very low grade chronic inflammation that can contribute to leaky gut. It can contribute to bloating, fatigue, skin issues, and even joint pain. And so when you identify these reactive foods, it allows us to create a very personalized anti-inflammatory diet to calm your system down while at the same time we're working on healing the gut. So the most important part is we don't run tests just for the sake of data. We test so that we can stop guessing and, going after symptoms, because that's really what you do when you're guessing, right? And we really take a very targeted approach. And when we have your functional lab results, we can create, and then we correlate that with your lifestyle, your medical history. We can really, truly come up with a personalized healing protocol. So, if your stool test shows low beneficial bacteria and candida overgrowth, we know that we need to focus on a specific probiotic and antimicrobial herbs, for example. If we see that you're not digesting fat very well, we can add digestive enzymes and some bile support to help with that. If your SIBO test is positive, then we can use very targeted protocol to address the overgrowth. And then, of course, if your food sensitivity test reveals a reaction to, say, eggs or, like in my case, almonds, we can remove those foods temporarily to lower that inflammatory burden on the whole system. So this is the essence of functional medicine, is we test and we don't guess. And we look for the upstream causes of what is happening and why you're having these symptoms. So it allows us to be very precise and also very effective. So it moves you from feeling overwhelmed to, and trying random diets, supplements, to having a very clear step-by-step plan based on your unique biology. And it's the difference between, say, throwing darts in the dark and flipping on the lights to throw your darts, right? And I know it can sound a little complex, but it's actually really very straightforward when you have the right guide. Most of these tests can be done right from the comfort of your own home. A kit is shipped to you. You collect the sample according to the directions that you get. You mail it back to the lab. The key, however, is not to just get the test, but having a trained practitioner interpret the results and then put that into the context with your health history, your symptoms, and your lifestyle. And that's really, truly where the magic happens. And this is exactly what I do in my practice and what I've been trained in. We use these tests as the foundation of our work together to create a very personalized roadmap to the healing. And it's how, my clients finally get answers that they've been searching for or have been, in that cycle of trial and error. And they start seeing real lasting results. And then, then they know what to look for and how to correct it on their own in the future. So if you're tired of guessing, tired of being told that you're quote unquote normal, and you're ready to finally understand what's at the root of your symptoms, then functional testing is your next step. And if you're curious to learn more about how the process works and whether it might be, the right fit for you, I invite you to book a free consultation, discovery call with me. We can talk about your health challenges. We can see how a functional approach can help you finally get the answers and relief that you deserve. So you can go to my website, wendyhandy.com, and book there, or you can go to the show notes below and book it with the link below. So I hope that this has been helpful. I hope that this gives you a little bit more understanding of what functional testing is and what it can do for you, and versus the conventional labs and the typical blood work that we all get, right? Our doctors, our primary care usually always does that once a year. And so I hope that this has given you a little bit more of an insight into how this works and how we put it together to actually get to what's causing your symptoms and your challenges, right? So thanks for tuning in today. Remember, your symptoms are real and there are answers. You just have to know where to look for them. So until next week, stay happy and stay healthy. Hey friend, I hope today's episode brought you some real value. If it did, would you take just 30 seconds to share it with a friend who might be struggling to get her gut in check? And if you're feeling extra generous, leave me a review on Apple. It absolutely lights me up knowing that this podcast is making a difference for you. All right, it's time for me to grab my protein shake and get my gut happy. I'll see you back here next Tuesday for another episode of Gut Fix. And until then, stay happy and stay healthy.